Well, good morning. This is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. This video is going to be an explanation which includes a comparison between aphasia treatment versus aphasia mentoring and treatment. Okay, so let's make that comparison now. So let's say you're in need of aphasia therapy or speech therapy, whatever that might be. And so you go and you find a speech therapist, and you go there, and the speech therapist gives you a number of treatments, which include exercises, maybe exercises out of a notebook or a word list or flashcards, or gives you an iPad or something like that. And you go home and you do that, and then you come back, and then you go home, and then you come back, and then you go home, and then you come back. And basically, you believe, and everybody else believes, that it's the speech therapist who's going to treat you, and it's going to be the speech therapist who is going to make you better. Unfortunately, that's a fallacy. Because a speech therapist can't make anybody better. They can show you what to do. They can give you a model for what to do. And if you do that, chances are you'll improve. But it's not like getting a medicine. It's not like going to a hospital and getting surgery. It's not a treatment that, well, you come and you get the treatment and you're cured. It just doesn't work that way. But a lot of people think it does, but it doesn't. So, and the reason why it doesn't is because aphasia is a type of treatment that requires a lot of repetition, and requires a lot of repetition in the context of living. So if you're going to go for a ride in the car, that's a context, okay? So that if you want to go for a ride in the car, and somebody says, let's say, ride in the car, each time you ride in the car, well, what happens is, after a while, there's a connection that develops. And if you're required to say ride in the car every time you get in the car, then an association begins to formulate. And if you can produce speech, and if you can recall with repetition, because we know that repetition helps improve recall, and we know that if something's important to the individual, then the chances of learning it are better, then that will occur. But you see, where the real learning, where the real improvement of speech occurs, is in the context of the situation at home whenever speech is required. It's not something that you go to a therapist and sit down behind a table in a little room and say some words or flashcards or a notebook. That doesn't do it. It just doesn't. And people think it does. Now, I'd like to compare that with speech therapy and mentoring. Now, when you go to a speech pathologist who is an expert in speech-language pathology or an expert in the treatment of aphasia, that person knows and has the experience of working with people and being able to prognosticate. And prognosticate means that individual can observe and make an educated guess as to how that person will do with treatment. So let's take the mentoring experience with speech therapy. What happens is that the speech pathologist evaluates the condition and then develops a set of goals. And then what happens is that the patient with aphasia returns to the speech pathologist, but also returns with a caregiver. And the speech pathologist trains the caregiver to do exactly that which he or she does. And it's really almost miraculous what can happen when a true expert can teach a caregiver or a wife or a husband what to do at home, and the therapist mentors that caregiver so that that caregiver begins to take on the capacities and the capabilities of the therapist. So what happens is that the knowledge, the experience, the practice of the expert gets passed on. It gets passed on to the caregiver. And as that knowledge and experience and practice, because every time they go to that therapist teaches them, so that the caregiver takes on the qualities of the therapist and can do exactly what the therapist was doing at home throughout the day. And what happens is the chances of recovery are exponentially improved. Because when you have somebody sitting in the room doing a notebook or flashcards, which has no context at all, versus training a caregiver to develop expert skills and competence at stimulating speech and language, and then sending that caregiver back home to do that there in real life situations. And that's how language is learned. You know, somebody said to me, Mark, well, you're going to have to prove that your method works. Well, I can say that it does work because that's how children learn to talk. Now, come on. That's how children learn to talk. They're at home. Their loved ones are around them. Their loved ones are saying words, making sounds, and the child is doing the same. The same thing goes with going to a foreign country. You know, some people say that the best way to learn a language is going to that country and speaking nothing but the language of the country. And within a short period of time, language is learned. Well, it's kind of like that, the same thing with speech and language at home. So anyway, to conclude now, the difference between formal speech therapy, where a person goes to a therapist, is to remember that the therapist isn't going to make the person better. It's not like the medical model, okay? The therapist is really like a coach, like a baseball coach or a pitching coach. They show the person what to do, and the person goes home and takes the knowledge, okay? But the problem with most people with aphasia is that they have memory disturbances, they forget quickly, and they need that reinforcement because the part of the brain that was damaged by the stroke doesn't work so well, so other areas around it have to work, and therefore it takes them a lot more repetition than it would a normal person. So that's why the home environment and context of the situation is the most optimum way to improve speaking. And again, the difference between the traditional approach, which I've just outlined, and the approach with mentoring is that the expert speech pathologist, the speech-language pathologist, basically trains the caregiver or the person at home, and that person takes on the skills and the capabilities and the capacities of the therapist and then continues the work at home. And it doesn't involve notebooks and it doesn't involve iPads, okay? That doesn't work to help people talk again who have a severe to profound speaking difficulty. It's just plain and simple. So that's the explanation today and the difference between traditional therapy and being mentored. This is Mark Idelman, speech-language pathologist. If you've liked this particular video, please give us a thumbs up. And if you'd like some more information about the teaching of talking and aphasia or apraxia, because we're taking on now an Aphasia project, and we hope that you might like to participate in our Aphasia project. And we're writing a new book on apraxia. And of course, we're also helping those with aphasia or apraxia speak again by training loved ones at home. So all about us is down right below this video. You can contact us through our website at teachingoftalking.com. Join us on Facebook and follow us at teachingoftalking.com on Facebook. And also, there's a questionnaire below this video, so that if you'd like to receive additional information about apraxia or about aphasia, or you'd like to speak with me personally about being mentored, you can fill out a little application form, a little question form, and we can set up a free consultation. And if I think I can help you, then we'll contact you, but we'll contact you either way. If I can help you, great. If not, then I can offer some suggestions to you. So, this is Mark Idelman. Hey, it's been wonderful to have this opportunity to share with you, and I hope you have a great day today, and I look forward to seeing you soon. Bye-bye now.